oncology and cancer management in Nigeria. Dr. Modu, what actually is oncology?
Okay, so oncology is a field, is a branch of medicine that deals with the study of cancer. And so onco is cancer, anything cancer, onco. And then logy, of course, is study. So it's just like cardiology. Cardiology is the study, cardiac is heart, and then logy is the study of the heart. So oncology is the branch of medicine that deals with, you know, the study of cancer. So cancer now in terms of the diagnosis and the treatment. That's the management of cancer.
I know in your area of work and experience, you have seen a lot of things that have to do with cancer. In fact, you are an oncologist, so you'd have come across a lot of these things. Please, can you just tell us what the numbers are, like in terms of persons that you've, you know, during your course of work that are actually exposed to cancer at the early stage, late stage, and all of that?
Okay, so the statistics they vary depending on where you work, where you live, whether it is you know, sub-Saharan, if it's the developing country or developed countries. So the statistics for cancer actually varies. But in my workplace, I would want to say that very commonly, the most common cancers you see in women is breast cancer. So for every 10 patients that walk into my consulting room, maybe more than 5 of them are, you know, breast cancer patients, because it is the commonest cancer worldwide. And then, of course, you have for the males, you have prostate cancer. In terms of, you know, whether it is early, late, it also depends on where you're practicing, whether it is the Western world, whether it is the developing country. But for us, I would say that a lot of our cancers, when I mean a lot, I would say more than 75% of our cancers are in the late stage, stage 3, stage 4. And so that is why, you know, more emphasis now is being laid on early detection, screening, early detection, so that we raise the statistics of early cancer, you know, and improve the probability of cure for our patients.
Okay, now in terms of preventing cancer, what could one be doing? Because like you said, the presentations are always late. What do you think one could do, the risk factors that one could avoid, or, you know, things we can do to avoid cancer?
Okay, so of course we have risk factors. The risk factors are just factors that you find most commonly in, you know, a group of people that have cancer and have been studied over time to increase their chances or probability of having cancer. These risk factors are actually, you know, modifiable and non-modifiable risk factors. The non-modifiable risk factors are things that you really cannot do anything about, like the genetics, you know, familial cases where you have a family history of cancer, maybe a sister or a mom. There's nothing you can do about that because it increases your risk. Even growing old, so age sometimes is a risk factor. You cannot do anything about growing old. The more you grow old, the more the cells of the body become tired, and sometimes they, you know, tend to now want to go against the normal regulation of the body, and then thereby leading to cancer. Also, the gender of the patient. There are some cancers that are very common in females, like the breast cancer. For breast cancer, you have the ratio of 100 to 1. So for every 100 females you find only 1 man with breast cancer. So the risk also increases with gender. So for those things, they are non-modifiable. You can't modify them. But of course, our focus in preventing cancer is to prevent, to make people try to improve on the modifiable risk factors. And what are these factors? These are factors that, you know, are around your environmental factors that you can work on to help decrease your chances of developing cancer. And I would say, of course, we have things like smoking. Smoking has been implicated in a lot of cancers, and you can do something about it. You can stop smoking, or you can you can decide not to ever smoke, and so it's a modifiable factor.
What about people that are married to people who smoke endlessly.
Very good. Second-hand smoking is now, even there's also the third-hand smoking, it's now a very important factor in, the cause of cancer, especially for lung cancer. There are so many, we're having increase in the incidence of lung cancer in non-smokers, and we're beginning to think it's has to do with second-hand smoking, and so those is also a risk factor. And so smoking in general, whether it is the person smoking or somebody that is that lives with the person smoking and has a high amount of contact with the person smoking. So smoking is one of them. Alcohol ingestion is also one of them. It's also been implicated in a lot of cancer. So deciding not to take alcohol or to drink very responsibly is also a way of decreasing your chances. Then let's talk about food. The modification of our diet, the westernization of our diet has increased.
When you talk about westernization, just break it down for those persons who want to know what diets are Western and which ones are not.
It has actually increased the risk of non-communicable diseases, which cancer is one of them. The non-communicable diseases, of course, we have things like hypertension, diabetes, and then cancer is also one of them. And so this, our diet, the change in our diet, now we have a lot of very westernized diets. Like you said, I should break it down. Refined diets. In the old days where you have your diet from leaves, vegetables, fruits, most part of your diets
are unprocessed.
Yes, but now they are processed. Now we have more of people taking very high fiber diets and diets that are rich in fats, in cholesterol, and these are the diets that expose you to, that increases your chances of having these non-communicable diseases. So if we are able to go back to those days where we have most of our diets being fresh, plant-based diets and all that, then we'll be able to reduce the chances. This is very important, especially for cancers in the gastrointestinal tract. That's your intestine, the stomach, because the transit time of this food within the intestine actually matters a lot. You understand? The more this food remains in the in the lumen, in the intestine, the more chances you have to exposure to toxins and things like that. So that's one of it. Another thing is sedentary lifestyle. Not moving around, not being very active, and weight. Obesity is one that cuts across almost all the non-communicable diseases, from hypertension, diabetes, and also cancer. So, weight loss, paying so much attention to, your weight and all that is also very, very important. These are modifiable risk factors that, help. When you pay attention to these things, they actually decrease your chances of having cancer.
Okay, Dr. Tessie, thank you very much. We'll take a break. When we come back, you'll tell us on how to prevent, furthermore, tell us on how to prevent cancer and what we should be doing in the Federal Capital Territory where you're currently practicing, so that we'll be able to close in into the community we are talking to here. Though we are talking to the world, but I want her to give me her experiences at the Federal Medical Center in Abuja. Don't go away.
Health is wealth. Folding letters and insightful information in Medicare and health technology. Join us live on NTA News 24 every Saturday at 4 p.m. as we delve into the current advancement in healthcare delivery in today's world. For sponsorship, participation, and inquiries, you can reach us on the following numbers: 0703 424 3412 or 0805 999 4444. Tune to NTA News 24 on YouTube, DSTV channel 419, GoTV channel 26, Star Times channel 101 and 433, and Free TV channel 703. Keep a date with us, 4 p.m. Saturdays with repeat broadcast on 8:05 p.m. Mondays. Don't miss it.
Welcome back from that short break. Our conversation in the studio with Dr. Amadu continues on oncology and cancer management in Nigeria. Dr. Tessie, talking about risk factors, we've heard some of that. Yeah. So what kind of things should we be doing, even if you had cancer or before you have cancer? What should you be doing rightly, that like you were talking about? Okay, sedentary lifestyle, that was where you stopped.
Yeah, I've spoken about, trying to improve on all those modifiable risk factors. It's basically like lifestyle modification. If you listen to everything I've said, smoking, alcohol, dietary, exercise, trying to lose weight and things like that, everything is basically lifestyle modification. So you modify your lifestyle to suit like a healthy lifestyle nature, and then it helps with decreasing not only cancer but most of the diseases that like all these things are related to. And I think the most important thing is for us to be health conscious. If you're health conscious, you would of course want to do things that would help increase your decrease your chances of having any of these diseases, not just cancer. So I think being very health conscious is one of those things. And then the second thing is that there are available screening methods for some of these cancers, for some of them that have known causes, like liver cancer, which is mainly from hepatitis virus. There are, vaccines for that. The human papilloma virus and cervical cancer, breast cancer, and doing your breast ultrasound, the mammogram, depending on the age with which you fall in the age bracket, and also prostate cancer and PSA. It's just a blood test, going to do. So I think routinizing this as an individual, telling yourself I need to do these things, is also part of modifying your lifestyle to be able to suit your chances to reduce your chances.
So you should make time to go for checkups,
of course,
unsolicited by doctors.
Of course,
you don't have to be sick before you go and check.
That is how to be health conscious. If you're health conscious, you would seek for these things. Most times people just say, oh no, I'm not sick, I don't feel anything, and so I don't need to go to see the doctor. And that's where the Western world have left us behind. Most of these things are done routinely. They are routine things, just the way you routinize maybe doing some other things in your life. That's how these things have been routinized now, and people just go for it. You don't need to be sick to check.
You actually have made a point. I had a patient on this, somebody living with cancer that came on my program here, and she told me that she's managing her breast cancer right now. She did not feel a single pain, nothing, but she just felt an innocent lump somewhere.
Of course.
And then when she went, she was already at stage 3. She is lucky because she responded fast. The stage she found out 2-3 days after that, she went into the theater and she was, now she's doing fine. She's recovering. There's some kind of remission and she's doing good. So people, what we're saying here is that early detection, checkup, schedule time, make time to go to check what your health status is. That is how we are managing HIV today. You have to go and check, find out if really you are well, because you don't have to be sick to go. Now for the men, they are usually shy. Men are just getting used to even talking about prostate cancer. It's just a simple blood check from what Dr. Amadu just told us. Now, the one that actually makes me frightened a bit, what is nuclear medicine? When the first time I saw nuclear medicine, it was like, wow, are we going to send, I don't know, it's like some space thing. What's nuclear medicine?
Okay, so nuclear medicine is also a branch of medicine that just uses, nuclear is radiation, so it uses radiation to diagnose and treat. It's like when you use when you say radiology is also like, you use radio is a radiation. Logy is the study of radiation.
Make a good teacher every day.
The use of radiation. And so that's it. Nuclear medicine, I would say, is like a super specialty of radiation, because you use some specialized equipment to detect cancer, not only cancer, other diseases, and also in the treatment of some of these diseases.
So now in treatment of cancer, what are the different methods you use?
Okay, so the treatment of cancer is, so one thing I will say is that cancer, the management of cancer is usually a multidisciplinary approach. That means not one person, not one physician can treat cancer alone. It's something that is multidisciplinary. A lot of disciplines, specialties come together, discuss, and that's why you must have a functional multidisciplinary team to be able to treat cancer very accurately. And so it's multidisciplinary and also multimodality. That means there are different methods to treat. And this will depend on the stage at which the cancer is gotten. If a patient is diagnosed at very early stage, then surgery most times is the main modality of treatment. There's usually a main modality to treat, and then there are some modalities that can be added to make sure that your treatment is complete, or to make sure that there's complete eradication of the cancer. So if cancer is gotten in the early stage, surgery is the main modality, where you just go, take out, the whatever is involved, and then, the patient achieves cure. But the moment you start getting to a late stage, like stage 3, stage 4, surgery may not be adequate as the only modality you will use. So in addition to surgery...
Okay, hold it there. Don't go away. I'll go for the personality of the week. Hold on to hear the other modalities, and when we come back, we'll wrap up on the oncology and cancer management in Nigeria. Don't go away.
Our health personality of the week is Dr. Ibrahim Wada, founder of the NISA Medical Group. He hails from Anyagba, Kogi State. A graduate of Ahmadu Bello University, Zaria, in 1980. He attended St. Charles College, Ankpa, Government Secondary School, Dekina, and Ahmadu Bello University, Zaria. He obtained a Master's of Business Administration in International Hospitals and Healthcare Management in Germany. He's a Fellow of Royal College of Obstetricians and Gynecologists in the United Kingdom, Fellow of the West African College of Surgeons, and has held consultant posts at Burnhall Clinic, Cambridge in 1992 to 1994, at Gwagwalada Specialist Hospital from 1994 to 1999, and a chief consultant at the National Hospital, Abuja. He became the medical director of Gariki Hospital, Abuja from 2007 to 2009, and now the medical advisor. Dr. Ibrahim Wada is a recipient of the National Award of the Officer of the Order of Niger, OON, conferred on him by the Federal Government of Nigeria in 2006 for his groundbreaking works in the field of in vitro fertilization, IVF, in medicine. When history was made in 1998 with the first government-authenticated IVF done by Dr. Ibrahim Wada at Nisa Premier Hospital, an internationally acclaimed gynecologist and fertility expert. Dr. Ibrahim Wada has authored more than 15 academic peer-reviewed journals and published 2 books, The Second Chance and PPP in Health. His achievements in the medical field cannot be overemphasized, as he has contributed and is still contributing his quota.
So now, doctor, just tell us in a nutshell. We're talking about radiation and chemotherapy and all of that.
Yeah.
So the options of treatment that you have.
So the options of treatment, like I said, surgery, radiotherapy, that's the use of radiation. You also have chemotherapy. Chemotherapy involves the use of chemical agents, which can be cytotoxic, it can be hormonal therapy, it can also be targeted therapy. There are some specialized targeted therapy that target directly at receptors that are expressed by the cancer. You can use that. There's also immunotherapy that's trying to manipulate the immune system, the signal pathways of the immune system of the body to be able to get at the cancer. So those are other ways that, you know, other modalities that can be used. Of course, there are also very specialized, highly specialized treatment, like the nuclear medicine therapy. There are some therapies that are targeted using radiation, very targeted therapy to the receptors that are expressed by these cancers using radiation. So those are some of the, you know, methods to be used. But we will not always forget the other parts of treatment, which are the non-pharmacological aspects. That's, you know, the psychology of the patient. All those things also have to be brought to the fore. Pain management. And so apart from the drugs that are used mainly to treat the cancer, there are other drugs that that can be used. There are other modalities that can also be applied, which if they don't come on board, your patient will not be fully treated. So you need the services of a psychologist. Cancer is a very, you know, it's when it's very emotional when a patient is diagnosed, and so to go through the journey and everything from the beginning, you need a psychologist to work on the mental health of this patient, and so we have all those modalities too. So apart from, you know, whatever it is that you're using to treat the cancer, you must also remember that these other aspects are also as important as, you know, the main treatment modality. Also, pain. Cancer is, you know, related with pain, especially when there is gotten in, you know, like the advanced stage of stage 3, stage 4. And so there's a need for pain control. And that's where your palliative care comes in. And, you know, this is a care that is given. It's not end-of-life care. And that's what people have to know. Palliative care is not end-of-life care. It's just care that you give to a patient to improve the quality of life of this patient while the patient goes through his or her journey in the cancer treatment journey. So palliative care has to also come in, you know, the patient has to be administered this care in addition to whatever you're giving the patient. So it's a very important aspect also that we must not miss when we manage patients.
Thank you so much, Dr. Tessie Amadu,
Thank you so much.
coming on our program. I'll meet you again and we'll keep talking about this and improving our knowledge on cancer care and oncology. Thank you so much for making this program.
Thank you so much
Thank you, viewers, for being with us. That's the end of our program today. On behalf of my crew here in the studio, I thank our executive producer, our supervising producer, and especially the Ministry of Health for all the information and all the things they're giving us, and the National Medical Association. Professor Bala Abdu, I thank you very much. We'll meet again next week. Don't go anywhere. On a Saturday at 4 p.m., I'll be here to give you more information on health.